All right. Well, I'm happy to be sitting here with Teresa Hasenour, one of the Redbeard team members doing craniosacral therapy, and she's agreed to just chat a little bit about who she is and what she does on our team. So, Teresa, just as a starting point, what is craniosacral therapy for folks who don't know, what that modality is?
Yeah, hi Alex. Craniosacral therapy is a modality that is a really gentle, light touch. It's similar to having an experience of going to get a massage where you lay on the table, except you stay fully clothed when you lay down on the table, and we're trained as craniosacral therapists to palpate a really gentle like movement in the body that is produced actually by some fluid that's produced in our brain, and it's produced there and reabsorbed, so there's a little bit of a rhythm that goes along with that. So that's what we're palpating throughout the tissues in the body and just noticing differences in different places in the body and getting a sense of where the person's body might need some support to help there be more fluid and more movement. One of the basic tenets in craniosacral therapy is that movement is health. So we look to find those places that are more stuck and help them with the use of our hands and some intention touch to be able to open those stuck places up.
Great. Um, yeah, and so what are the some of the common concerns that bring people into craniosacral therapy specifically? Musculoskeletal things, or nervous system things, or emotional things. Well, what can craniosacral therapy help with?
Yeah, all of those things that you just mentioned, I see people coming in the doors for. A lot of times I have people coming to me who are dealing with headaches or tension in their jaw or neck area. So some of it's short-term things that have come up, and some folks are coming in with long-term or chronic pain issues they've been dealing with. And I've also seen people come in a lot for kind of the like anxiety and just general stress and trying to look for some ways to manage their stress. And then there are clients who have been, maybe working with counselors on some, stressors or, different difficult times or traumas in life that are ready to start to explore a little bit more of an embodied, practice that can connect sort of like the mind with their body and their body experience. So it's kind of the whole gamut. But for me, it seems like I've seen a lot more with like headaches and chronic pain and anxiety. It seems like I've noticed that a little bit more recently.
Cool. So your background, your licensing is as an occupational therapist.
Mhm.
What drew you specifically to craniosacral therapy as your primary way of working with folks?
Well, as an occupational therapist, we're trained to really look at the whole person. So it's not just the physical body that we're addressing when we enter the room with a person. So I like that in the profession that I chose to get into. And then I noticed with craniosacral therapy, there was also a similar aspect to that where we are really integrating like all aspects of the person that comes in the room. So even though it's on the surface it looks like a physical hands-on modality, there is a depthness to the work that can tap into those other aspects in people's lives that are challenges for their day-to-day function, or things that that they're struggling with that they want to be able to get back to. And so I feel like this technique is a nice like gentle approach to helping people get back to their normal daily activities and to the things that bring them meaning or the things that they have to do. So it really spoke to me because I think I have a little bit more of a softer, like more gentle approach in life in general. And so cranial psychotherapy like really fit with kind of the way I like to interact with people. So
Cool. Do you have any sort of story about kind of when you first kind of found craniosacral therapy, or why you felt it was effective? Like, maybe it was effective for you, or you saw something with the modality that really resonated with you.
Yeah, in one of my early sessions that I received, and it's kind of was sort of a minor thing that I was dealing with, but I had this in my upper trap. I had this pain and tension and like a knot that I couldn't get it out. I was, I knew techniques to like manually do it, massage and different things, and even had other people work on it, and I couldn't get that to go away. And it just so happened I had a craniosacral therapy session set up with someone, and so she worked with me, and in that session, like long story short, there was a little bit of some facilitation on her part with her questioning and things like that that actually helped me kind of tie into that spot, and realizing that that tension was coming from kind of a little bit more of a maybe a psychosomatic or something experience in my life where once we talked that through and I was acknowledging like, wow, I'm really noticing these things. And the way it actually came through was kind of like a dreamlike state, because with craniosacral therapy, it kind of have a ability to bring the brain waves down into a slower rate. So anyways, that's like kind of how that all transpired. But long story short, I got off the table and that pain was gone. And I've actually never had that same muscle knot or tension ever again, like since I had that session. So that was my first like little encounter with it, that I was like, wow, there's something to this work. And since then I've had several other sessions that have been really like interesting and in depth and meaningful for me. So it continues to be a great exploration for me personally as well.
Very cool. So you mentioned at the beginning, one of the main premises of craniosacral therapy is feeling for the craniosacral rhythm, the flow of fluids in the body, and then attuning to where there may be restriction and helping facilitate more fluid flow and whatnot. And then there's a component of craniosacral therapy that I've heard about, and I know you do it, called somato-emotional release, if I'm saying it correctly. Could you just describe a little bit about what that is and how that works?
Yeah, with somato-emotional release, this is really where we're feeling in the system that there might be kind of an area of disorganization in the body, and so that has a certain different feel than the normal rhythm. And so sometimes, not always, but sometimes when we're working in that area to help it release, the person may experience a memory or emotion that kind of comes up and moves through their body that that is just kind of a part of this area that needed to come out. And so sometimes people are surprised that like, oh, I just remembered I was in this accident like however many years ago, and I haven't thought about that for however long. So it's a part, some of the physical things that can happen, but it can get into some other struggles that people might be having in their lives around accepting how life is and how they want things to be, or things that have happened in the past and how to like integrate and come to terms with those experiences. So sometimes it can go through a little bit more of a journey with the somato-emotional release. And it's definitely something that we can focus on in a session if a client wants to like go that way. However, a lot of times it just kind of will come up organically, and it's not every single session that's going to occur. So
Hearing that, it gets makes sense to me that there'd be people who as a component of their, they might be doing a talk-based therapy approach, like trauma therapy or talk counseling or somatic experience or something like that. And it sounds like this could be a good complement to sort of psycho-emotional work like that because of the way you just described it.
Yeah, and we sometimes will use a little bit, it might seem kind of odd for some people, but we'll sometimes use a little bit of a facilitation where the person actually really connects to that area in their body that they're feeling something, and and really paying attention to what that area actually might have to tell them. So that can be a new experience for people to do that, but it can also be really enlightening to like kind of get this information coming through without really thinking about it, and to realize, you know, a little bit more of a, oh, okay, this is really important for me to like maybe pay attention to what my body's saying and to follow. And so I think it helps. That's one of the reasons why I'm drawn to craniosacral, because I think it helps give us a chance to have more insight into the communication and the expression and languaging that comes from our body.
Very cool. Awesome. Well, I really appreciate the chance just to chat about craniosacral therapy with you.
Yeah, thank you. I appreciate it as well.